afternoon, everyone. I will be talking about fine motor skills and amblyopia, which is less explored entity in amblyopic children. As we all know, amblyopes have poor stereopsis, and that's why they can have difficulty in doing tasks which rely upon a stereoscopic vision. And this functional disadvantage of amblyopia has not been fully explored in childhood population, and there is scanty literature and which has compared the type and severity of amblyopia with fine motor skills in children and adolescents. So we have done a study aiming to study the impact of amblyopia on fine motor skills in children and adolescents aged between 4 to 18 years. The primary objective was to compare the fine motor skills in children and adolescents with amblyopia aged between 4 to 18 years with age-matched controls. And the primary measure was Bender Visual Motor Gestural Test. And the secondary objective was to study any possible association of severity of amblyopia and different etiology of amblyopia with the degree of fine motor skill. The study design was hospital-based prospective cross-section study. The duration was April 2022 to 2023, and the sample size was 82, including the cases and controls. And the study population was taken from the patients visiting ophthalmic OPD and pediatric OPD of AIIMS Rishikesh. The cases and controls were recruited according to the inclusion and exclusion criteria, and those willing to provide written informed consent, and age range was 4 to 18 years, and only orthophoric patients were taken, and with having a primary position alignment within 8 pins diopter horizontal and 4 pins diopter vertical. The exclusion criteria was any existing pre-existing vertical or horizontal misalignment, or any history of previous ophthalmic surgery other than strabismus, any retina and macular disease or ocular trauma, any neurological disease or intellectual disability which can compromise the fine motor skill. After taking consent, the all basic workup was done, and the fine motor skills were assessed by 4 measures: Bender Visual Motor Gestural Test, Jepson-Taylor Hand Function Test, and Ray-Ostrich Complex Figure Test, and Developmental Coordination Disorder Questionnaire, which was subjected to the parents of the patients. And all these tests were performed by a trained resident in supervision of a pediatric neurologist. In Bender Visual Motor Gestural Test, it consists of 9 index cards, and patient was asked to copy this, and the scoring was done according to accuracy and organization of the reproduction, and scoring was given between 1 to 13, and higher score indicated poor performance. Then Ray-Ostrich Complex Figure Test was done, and patient was asked to copy this replica, which is Ray complex figure, and again scoring was done, and the score was given between 0 to 36, and in this lower score indicated poor performance. In next test, Jepson-Taylor Hand Function Test, the patient was asked to do 7 things: writing, turning over pages, picking up small objects, fine objects, large objects, and so many things with both hands, right and left hand, and the scoring was done. The time taken to accomplish the task was recorded as the score. And the last, Developmental Coordination Disorder Questionnaire, this was subjected to the parents, and parents were asked about the different coordination problems, and it consisted of 15 items, which include control during movement, fine motor and handwriting, and general coordination. So primary outcome measure were assessed. That was visual motor coordination. That was assessed by Bender Visual Motor Test. Then secondary outcome, upper limb dexterity, was assessed by Jepson-Taylor Hand Function Test, and visual spatial constructional ability was assessed by the Complex Figure Test, and visual motor coordination was assessed by the questionnaire. The mean age was 9 in control cases and 8.44 in controls, and the male and female ratio was similar in both cases and controls. The most common type of amblyopia in our study population was meridional, followed by anisometropic, and strabismic and emmetropic. And the most common population, up to 74.55 patients, were moderate amblyopes. And we saw the type of refractive error. The astigmatism was the most common type of refractive error, followed by hypermetropia in cases, and hypermetropia was the most common refractive error in controls. And we also assessed the baseline and that body mass index, which was not related to the severity of amblyopia. And the primary outcome, there was a statistically significant difference between the primary outcome measure that was done in Bender gestal test. Then all secondary outcomes measures had statistically significant difference between cases and controls. Also on subgroup analysis, there was only strabismic amblyopia has significantly, on subgroup analysis there was no major difference within the other types of amblyopia, but only strabismic amblyops have significantly reduced fine motor skills. So the mean standard deviation of the fine motor test in amblyopic group was significantly higher than controls, and proportion of amblyops, only 40 patients of cases had binocular single vision, and rest of the patients they didn't have. Poor performance by amblyops and controls with reduced and nil stereopsis was observed, that is very obvious, but only strabismic amblyopia was found to have most abnormal fine motor skills that we have already said. So to conclude, amblyopia adversely affects the fine motor skills of children and adolescents, and this entity is still to be explored, especially in Indian populations. There is no Indian study till date. And to reduce stereoacuity may have to related to this. This is obvious, but especially we are emphasizing the strabismic part of strabismic amblyopia has poor prognosis. So this highlights the importance of early correction of strabismus. The patient's strabismus surgery should not be delayed till most of the clinicians say do it in adulthood, 18 years का हो जाएगा तब करेंगे, and patient land up with severe amblyopia, and these problems can hamper their other job selections and all. Thank you.
Thank you, Dr. Anupam Singh. Thank you very much. We'll have questions at the end of this session, so whatever you want to